I'm going to show you a very cool illustration from a seminar I attended, and it was on periodontal disease as wound care. And basically one of the comments that the presenter made, that the American Medical Association has an exact protocol on wound care. Okay, if someone presents with a wound, there's an entire protocol. The American Dental Association has no such protocol for wound care. We don't have a protocol that says if you present with an oral wound, this is what you do. So his whole premise was periodontal disease was a wound and should be treated as such. Here's the illustration he made that was cool. So let's say that you are on your skateboard and you kind of take a header, palms on the concrete, and you scrape an area, a chunk of flesh off of your palm that big. That's the equivalent of the surface area of the inner linings of all of your pockets around your teeth. Okay? So if they bleed, which the majority of people do, that's the equivalent of having a wound this big. Now, think about this for a second. So, let's say that you don't take proper care of this wound and it becomes infected, and you end up, you know, in the primary care office or in the emergency room. You say, "Doc, hand hit the ground, scraped a chunk of flesh off, you know, this thing's nasty. What do I do?" And your physician comes to you and says, "Well, here's what you need to do. Got a piece of string, and I need you to brush this a couple of times a day, and you're pretty much good to go." Now that sounds absurd, and you're going to go, you know, "Are you kidding me? Dude, where's my antibiotics? Where's my antiseptic?" But think about this for a second. Tens of thousands of people visited the dentist today in an office, probably a dental hygienist. Their gums bled, they have an open wound, and they were given a piece of string and a floss. That's a heck of a visual for me. I mean, that really drives home the point of what we need to do to change our paradigm on how we're approaching the practice of dental hygiene.